I always tell my patients swimming is an excellent exercise. It's great for the heart and for the lungs, but it does nothing for the bones. The bones need high impact, it needs gravity. So things like weights training, going out for brisk walks, for example, those are very important for the bone density. Hello, my name is Dr. Ziad Farah. I'm a consultant rheumatologist and general internal physician. Today I'm going to talk to you about osteoporosis. Now, what is osteoporosis? It's actually quite a common condition that I see a lot of patients for. It is a condition that is characterized by weakening of the bones. To identify what it actually means, so osteo means bones, porous means holes. So our bones consist of an outer shell, which is quite thick, and inside there's a large network of connecting bone, almost like a honeycomb. In osteoporosis, the holes within that honeycomb become larger and the actual bony structure becomes thinner. And the result of that is that the bones are more likely to fracture or break. So why do we get osteoporosis? Our bones naturally go through a transition over time. So when we're younger, we build bone. The density of our bone increases and usually it plateaus or reaches its peak at the age of 25 and stays at that level to about the age of 40. After the age of 40, our bone density gradually declines. This is part of the natural aging process. There are, of course, factors that influence how quickly the bone density declines. For example, the menopause, which is associated with a rapid reduction in estrogen and other hormone levels in the blood, and that causes the bone density to decline a bit more rapidly around that time. That is probably why osteoporosis is more common in women than in men. So what are the risk factors for osteoporosis? The risk factors for osteoporosis are things that you can't change. For example, being female or male. Women are more likely to get osteoporosis by virtue of their bones being naturally of a lower density on average. Genetics is also very important. Having a strong family history of osteoporosis puts you at risk of it, in particular if any of your parents have suffered from a hip fracture. There are, of course, lifestyle factors that contribute to the development of osteoporosis. Obesity is a risk factor. Being very underweight is a risk factor. Smoking, excess alcohol, and other medical conditions, for example, things like diabetes or inflammatory arthritis put you at risk of osteoporosis. Medication can also play a role. Commonly, recurrent uses of steroids or being on anti-epileptic medication, those also increase the risk of osteoporosis. So how do we diagnose this condition? Well, it's important to recognize that osteoporosis in itself is not painful. It is actually the fracture that results from osteoporosis that causes the pain. So usually it is identified in patients who've had a fracture or have other risk factors in their history that put them at risk, and so we screen for it. The way we do that is with a bone density scan. Now this is an X-ray essentially, which shines X-rays through the bones, mainly the hip and the spine, and through a clever computer software, it can calculate the bone density. And then the bone density is compared across the kind of population. And so you're given a score that compares how far or close you are to average. And there are certain numbers which signify being borderline, osteopenia, or having proper osteoporosis. And obviously the lower the density, the more in the osteoporosis range you may be. How do we manage osteoporosis? Well, it's really important to recognize lifestyle factors play a key element here. So modifying these would be very important. Ensuring adequate vitamin D intake, whether it's through dairy or other non-dairy dietary intake, or supplementing with vitamin D supplements. Ensuring regular weight-bearing exercise is very important. I always tell my patients swimming is an excellent exercise. It's great for the heart and for the lungs, but it does nothing for the bones. The bones need high impact, it needs gravity. So things like weights training, going out for brisk walks, for example, those are very important for the bone density. But obviously sometimes lifestyle factors are not enough. And some patients require medication, particularly those who've had a fracture, who are always at more risk of another fracture in future, or patients who have significant osteoporosis on scanning. Now, the treatments that are on offer depend on which bones are affected, age group, for example, but in general, there are oral options. These are things called bisphosphonates, such as alendronic acid, and these target the cells in your bones that kind of reduce your bone density. There are natural cells that eat away at the bones. These medications target those cells. Others are certain hormone treatments that we can give by injection, for example. And there are many newer drugs, like biologics, which we can give that help the bone to build rather than stop it from declining in its density. So there are many options available, but it's important to recognize that all of these different factors together play an important role. Again, early diagnosis is helpful and monitoring is key. So this is not a simple diagnosis on a one-off visit, for example. And I would only suggest repeating the bone density every 2 to 3 years because it takes time for any intervention to actually have an impact on the bones.